Hello everyone. In this video, we are going to discuss about conjunctivitis. So what is the definition of conjunctivitis? It is nothing but the inflammation of the conjunctiva. What is conjunctiva? Conjunctiva is a thin transparent mucous membrane which lines the eyelids and covers the sclera. Okay. So if it lines the eyelids, it is called as palpebral conjunctiva, and if it lines the sclera, it is called as bulbar conjunctiva. As we can see in this image, the conjunctiva lining the sclera is called as bulbar conjunctiva, whereas the conjunctiva lining the eyelids is called as palpebral conjunctiva. Similarly, in a cross-section view, this is a bulbar conjunctiva which I have been showing in red, and the palpebral conjunctiva is shown in black. As we can see, bulbar conjunctiva itself has continued and forming a fold-like structure. It has become palpebral conjunctiva, and the space created here is called as conjunctival fornix. Okay, this is about the normal anatomy of the conjunctiva. And in case of conjunctivitis, entire eye becomes pink, and this is also called as pink eye. Okay, whereas in case of subconjunctival hemorrhages, there are dots and blots of blood bleeding which can be seen in the eye. Coming to etiology or classification of conjunctivitis. Based on the cause, conjunctivitis can be infective, allergic, or any other cause. Okay, among the infective causes, it can be bacterial, viral. Bacterial can again be classified as acute bacterial conjunctivitis or chronic bacterial conjunctivitis. What are the organisms causing acute bacterial conjunctivitis? They are the most common ones being Staphylococcus aureus, Streptococcus pneumoniae, and Haemophilus influenzae. Hyperacute bacterial conjunctivitis is caused by Neisseria gonorrhea. Okay, chronic infective or chronic bacterial conjunctivitis is caused by Chlamydia trachomatis. So acute is mainly by Staph aureus and Streptococcus. Whereas hyperacute is by gonorrhea, chronic is by chlamydia. Viral conjunctivitis is caused by adenovirus, which is the most common one. Other viruses being enterovirus and herpes simplex virus. So this was about infective etiology for causing conjunctivitis. Allergic conjunctivitis is mainly seasonal, and hence the name seasonal allergic conjunctivitis. Allergic conjunctivitis can also be of other type called as vernal keratoconjunctivitis and atopic keratoconjunctivitis. Okay. Other causes for conjunctivitis can be chemical irritants or mechanical trauma. So basically, whatever happens, whatever injury, or there should be some stimuli for the conjunctiva to react by in the way of inflammation. So because of that, there will be inflammation in the conjunctiva, and hence it is called as conjunctivitis. What is the pathophysiology? What exactly happens that leads to conjunctivitis? In case of bacterial conjunctivitis, direct infection by the bacteria will happen. Because of that, there will be release of toxins from the bacteria, which will lead to stimulation of our immune system, and our immune system will deploy neutrophils. Because of that reason, there will be neutrophil infiltration in the conjunctiva, leading to mucopurulent discharge. Whereas in viral conjunctivitis, viral replication takes place in the epithelial cells. And as we all know, viral is usually chronic, and it will activate the immune system, and immune system will deploy lymphoids or lymphocytes basically, and this will form lymphoid follicles reaction, leading to watery discharge. So what we came to know from this, in case of a bacteria there will be mucopurulent discharge, whereas in case of virus there will be watery discharge or a serous discharge. So based on the clinical features or on the appearance itself, we will be able to differentiate whether it is bacterial conjunctivitis or if it is viral conjunctivitis. In case of allergic conjunctivitis, it is a type 1 hypersensitivity reaction. So there will be mast cell degranulation, because of which there will be histamine release and intense itching will be there. That will lead to severe redness and chemosis. Okay. This was about the pathophysiology of conjunctivitis. Now coming to clinical features. Again, for all type of conjunctivitis, these are some general signs, like redness will be there in all type of conjunctivitis because of diffuse conjunctival hyperemia. That is, vascular supply to the conjunctiva is improved or increased, because of which there will be redness, and then there will be a sensation of foreign body, like something is there in the eye. It will be itching, and because of that there will be watering also. Along with that, photophobia and discharge will be depending on the type of conjunctivitis. If it is bacterial, it will be mucopurulent. If it is viral, it will be serous. Okay, so these are the common signs which will be present in all cases of conjunctivitis: redness, foreign body sensation, watering, photophobia, and discharge. So what are the type specific features of conjunctivitis? In case of bacterial, it is acute in onset and mucopurulent discharge will be there. Lymph nodes will be absent because neutrophils are implicated here. Okay, eyelids get stuck in the morning because of this mucopurulent discharge, and this is a sign that okay, this is a bacterial conjunctivitis. In case of gonococcal, which is a hyperacute Neisseria gonorrhea, that is gonococcus. So gonococcal ಅಲ್ಲಿ sudden, severe, and it will be hyperacute. So in that there will be copious purulent discharge, more amount of purulent discharge will be there, and lymph nodes will also be enlarged. So what are the features we will see? Other features: chemosis and corneal ulcer risk is more in case of gonococcal conjunctivitis. In case of viral, it is usually subacute or chronic, and watery or serous discharge will be present. Lymphoid follicles are implicated, so lymph nodes will be enlarged, and follicles preauricular or preauricular node enlargement can be seen. In case of allergic conjunctivitis, it is usually seasonal or chronic. Watery or stringy discharge is present. Lymph nodes are absent. Intense itching, redness, papillae, giant papillae in case of vernal keratoconjunctivitis is seen. So these are the type specific features in case of conjunctivitis. Again, just brushing through the image of symptoms of conjunctivitis: redness in the eye, watery eyes, thick yellow discharge, that is mucopurulent discharge in case of bacterial conjunctivitis, burning sensation in the eye, itching in the eye, and swollen eye. These are the usual common symptoms with which patient come to us, and we diagnose conjunctivitis. Again, these are the types of conjunctivitis. These are healthy eyes. Allergic conjunctivitis, it is hyperacute, redness is there, severe itching will be there. In case of viral conjunctivitis, serous discharge is there, watery discharge, so hence it is leaking out. And then along with that, redness, these are all common for all types of conjunctivitis. In bacterial, again, mucopurulent discharge is present, like pus-like discharge, and redness is common again. So these are the types of conjunctivitis. How do we investigate? How do we come to the diagnosis of conjunctivitis? We'll go, usually it is clinically diagnosed, like seeing the redness of the eyes, we can say okay, this person might be having conjunctivitis, and after that we will again ask the history or do further examinations about the discharge and all for coming to the proper diagnosis. Other than that, if it is a bacterial, we can take a culture, and we can do gram stain and send for culture and select appropriate antibiotic also. Giemsa stain can be done for diagnosing chronic bacterial conjunctivitis like chlamydia, which shows basophilic inclusion bodies. And if it is a viral conjunctivitis, we can send for PCR. And allergy testing, which is rarely done for allergic conjunctivitis. So after this, treatment. What are the general measures? General measure is trying to prevent acquiring infection. That is possible by maintaining ocular hygiene, avoid sharing towels, cosmetics, cold compress for comfort. In case of bacterial conjunctivitis, what is the treatment? Obviously, for bacteria, we'll give antibiotics. Topical broad spectrum antibiotic drops like moxifloxacin, chloramphenicol for 4 to 6 times a day. Whereas we can also prescribe ointment at night. Same moxifloxacin ointments are also available. We can prescribe that. In case of a gonococcal conjunctivitis, IM or IV ceftriaxone plus frequent saline irrigation is needed. For viral conjunctivitis, we'll usually viruses, we know there are no specific treatment for that. So supportive treatment is there, that is by providing artificial tears like CMC eye drops or cold compress. And then topical antihistamines can be prescribed for prevention of itching. Okay, avoid steroids unless severe inflammation is present. In case of allergic conjunctivitis, allergens should be avoided. Like if the person gets conjunctivitis whenever he goes out in the environment where there is more dust, so he should avoid that first. Okay, otherwise if the person is having dust whenever he cleans his room, he should avoid cleaning room. Okay, avoiding the allergen is the first treatment for allergic conjunctivitis. After that, again, for symptoms, symptomatic management. If there is severe itching, provide him topical antihistamines, or you can prescribe oral mast cell stabilizers like olopatadine or azilastine also, or topical mast cell stabilizers like these also. Short course mild steroid drops for severe VKC and atopic keratoconjunctivitis will help. Coming to what happens if we don't treat conjunctivitis, that is chronic conjunctivitis will happen. Like if we don't treat acute conjunctivitis, it will eventually become chronic conjunctivitis. After that, we know it is covering sclera, cornea and eyelids. So it can lead to corneal ulceration, especially gonococcal, chlamydial and severe vernal keratoconjunctivitis. Membrane or pseudomembrane formation can happen if not treated in case of viral and severe bacterial conjunctivitis. There can be formation of symblepharon, which is a cicatricial disease. Like what is symblepharon actually? It happens like this. There is a wing shaped or connection growing. This is conjunctiva encroaching the cornea. So this can be a complication of conjunctivitis if not treated. How do we prevent conjunctivitis? Just like I told before, how can we prevent conjunctivitis? By preventing acquiring the infection. For that, personal hygiene is needed. Isolation of contagious cases. If one person is having conjunctivitis at home, try to avoid contact with that person until conjunctivitis heals. And then frequent hand washing, because just like we saw, bacterial conjunctivitis was spreading through direct route. Okay, so if we don't wash our hands and if we touch our eyes, there will be direct contact, it will spread. Avoid contact lens use during active infection. If the person is having conjunctivitis, he should avoid using contact lens. So these are the preventive measures. This was all about conjunctivitis.